Hi guys, come along with me today to treat this patient. We did a comprehensive treatment on this patient. She doesn't ever really get treated often because she's from out of town. So we decided to do a little bit of a comprehensive full face filler for her. We decided to do cheeks, piriform, and chin. So as you can see, here I am injecting the cheek. This injection is down to bone. You want to make sure that once you're down to bone that you're aspirating really well. You can come back out, reposition, and kind of reassess where to put that product. The way I go about it is I usually lean my patient back in the chair at a 45-degree angle and look over them and kind of assess what deficits they have. I always try to assess what side of the face my patient sleeps on as well, because usually that side has a little bit more of a deficit than the other side. So kind of just fully assessing your patient before you get started to kind of come up with a plan of how much product you're going to use bilaterally. I'm just going along the zygoma here and making sure that I am placing product directly on bone. So I'm entering at a 90-degree angle. And then as you can see, I'm placing my hands so I can get a good aspiration in. Always checking that hub because that's where you're going to see a positive aspiration first. And then I'm pushing product. I usually start on one side of the cheek, kind of assess it and fill it to a point where I think it's good, and then I move on to the other side. I always tell people when you're filling cheeks, chin, piriform, you're constantly looking at the tissue for it to rise and lift. Yes, you're being cautious about how much product you're pushing at one time to ensure that you're not bolusing. But overall, it shouldn't be calculated that you're going to push 0.5 on the side and then 0.5 on the other side. Kind of just assess and see as you go. This approach is a little bit different than the rest. Before I was going at a 90-degree angle, but this one I'm going submalar. The reason why I'm doing this is because it's going to lift that apple of that cheek a little bit more during this approach. Note that this injection is a little bit more high risk, so it's very important that you're doing a very good aspiration here. Here I am doing another one of those injections. If you ever struggle with getting on bone when you're entering, it might be the length of your needle. A lot of patients have these really full cheeks, so sometimes you have to use a needle that is slightly longer in order to really reach that bone and ensure that you feel comfortable injecting. Here I am supporting that tissue underneath that filler just to ensure that it is comfortable for the patient. Moving on, we are going to chin. It's very important to note that we did ultrasound this area. We ultrasound to make sure that there is no vasculature right down to bone on the midline of this chin, and there was not. So we are safe to inject here. When injecting, I was looking at the patient, and what she really needed was a little bit more projection, and the shape of her chin was just a little bit square. So we were trying to round that out a little bit and give her more of a sweetheart look to her face. We're using the same injection technique as the cheeks. We are going straight down to bone, and then once you're on bone, you're giving it a good aspiration for a couple seconds, and then once you're in the clear and there's no positive flashback, that is when you can push your product. Again, you're not bolusing product, and you're really watching that tissue to make sure you're not seeing any color changes, and you're watching that tissue fill so you know when to stop filling that area. Another thing to note in this area is that you do not want to be wider than the nostrils on each side for a female patient. The width of a chin should not be wider than that because that is going to make the patient look more masculine if they are female. So just a reminder, if you are injecting a chin on a woman, you are to stay in the borders of their nostrils or their nasal areolas. If you're injecting a chin on a man, it's going to be a little bit wider and it's going to go more towards the oral commissures. So just know that that is your boundaries when injecting male versus female. Something that I like to do when I inject is just support underneath the chin just to make sure I'm really isolating that product and it's not moving. I also massage my patient's chin as I go to kind of help form and shape that filler in that chin. Now we're moving on to the piriform space. This is also a higher risk injection, so this is another area that we ultrasounded. Same injection technique though, we are going straight down to bone, giving a very good aspiration. I want a couple seconds here just to really make sure that I'm in the clear. And then you're pushing product slow and low. You're watching that tissue fill and you're making sure that you're not bolusing tissue. This is a very pinchy area for patients because your foramen is right near this area. So just kind of educate them that it's going to be a little bit pinchier. And also too, if their lips or their nose goes a little bit numb, that's completely normal because the product has numbing in it. It's going to numb around that area and it's going to be a weird sensation for about an hour or two. So just keep that in mind. After we're done injecting, I like to use arnica on my patient. So as you can see, I'm putting arnica on her cheeks, piriform, and chin, and I'm giving each of those areas a nice massage. I'm kind of identifying what is a hematoma, what might be a bruise, checking coloration of tissue to make sure that it looks adequate enough to send the patient home. And I'm really just massaging out any lumps and bumps if there are any. Just a reminder, it's important to educate your patient about any complications and risks that may occur from these procedures and signs and symptoms of what to look for when they do go home so they can report it to you adequately.